Hello and welcome back to TCTV On Location here at Maumee Bay Pediatrics, and I'm here with Carrie Baker. She's a certified nurse practitioner in pediatrics, and I have a question. A lot of times kids have to get sports physicals before playing when they're of school age, but is that the only time parents should be bringing kids in for wellness checks?
No, actually, the American Academy of Pediatrics recommends a time schedule for kids to actually come in and get well checks. In the beginning, in the first 2 years, it's every 2 months to sometimes every 4 months. That's basically to get the children, make sure that they're meeting their developmental milestones, making sure that they're not falling behind in language development, making sure that their growth pattern is good, especially since the brain, 90% of the brain is actually developed cognitively by the age of 5 or 6. So we're watching a lot of their developmental milestones in those first few years, as well as their physical growth. And that's also when they get all of their immunizations. Up by the age of 5, they'll have most of their immunizations and don't receive them again until 11. But it's also important after you get through those first 2 years and you're fully immunized and the developmental milestones have been met, is you want to make sure that a child's not falling through the cracks with anxiety, depression. We do ADD scores, make sure that academically that they're doing well. And it's also a lot of preventative measures now. The American Academy of Pediatrics asks us to do yearly urines and hemoglobins and iron levels, to kind of do a lot of disease prevention. We're seeing a lot more obesity, diabetes in children at a much younger age, even cholesterol. The American Academy of Pediatrics recommends that we test every child over the age of 9 for a first screening of cholesterol. So as we're starting to see more adult diseases enter the pediatric population, it's very important that they come in for an annual physical so that we can just make sure that they're not having any issues or prevent any diseases that they may be heading towards. So we can kind of turn the ship around, educate the parents, and make the needed changes before they get into the chronic diseases and conditions.
Because a parent, you're going to be with that child every single day. You may not notice some of these changes that are happening with your child, right? And it's good to get that second pair of eyes.
Yes, and a lot of the screening tools that even we do for anxiety and depression and, hyperactivity and impulsivity are subjective tests that the parents answer questionnaires and the child answers questionnaires. And after we sit down and we review them and we score them, oftentimes the parents are very surprised at where their child's actually at compared to where they think that they're at. So oftentimes you will uncover a lot of things that the child may not have even known was going on, or the parent. Or sometimes it's just if you don't know what you don't know. And so if you're not medically minded or have anybody in the family that's medically minded, you may not realize the different signs and symptoms of diabetes or of high cholesterol. So it's not always at the fault of the parent. It's just if you don't know, you don't know.
So if you have, a 10-year-old, 13-year-old, someone in that age range where maybe they're not talking to their mom or dad that much, maybe embarrassed about some things that are going on, what are some things you would recommend that parents say to their kids to encourage them to be open and honest with you or their physician?
I think I don't really know the answer to that question. I know that in my own physical exams that anytime I'm doing a preteen or a teenager, there's always a time that I ask the parent to step out of the room and I just have a very candid conversation. And I think that the more relaxed the patient is with the provider, the more willing they're going to be to talk. And oftentimes they will say things to somebody else that they won't say to their parents. I think that's typical of most kids, especially in those preteen and teen years. So I think it's more of a rapport that you build with your patient and the way that you, I don't want to say interview, but the way that you discuss issues with the child without the parent in the room. I mean, that's how I approach it, and I think I've had pretty good success at it. So,
well, thank you so much, Carrie. This is all the time we have for right now, but we'll be back with more.